thank, shout, Uhuru for this story. This is a story that came out in Mother Jones, December 7th, 2017, and I will leave the link to this story in the description box. The Republican tax plan is a disaster for addiction treatment. So much for fixing the opioid plague. And, let me tell you something. Trump ain't interested in helping these addicts out here. I've said it in multiple videos. I'm going to say it in this one too. Deep within the Senate bill, which passed earlier Saturday morning, are provisions that could have a big effect on addiction and treatment, leading millions of Americans with substance use and mental health disorders to lose their insurance and increasing the number of Americans dying from alcohol related causes. The legislation is still a work in progress, with GOP leaders and House Senate ironing out differences with the goal of presenting Trump with legislation by the end of the year. Amid a spiraling opioid plague and record high alcohol related deaths, the legislation could put Obamacare on track towards a death spiral, said Keith Humphreys, a Stanford psychiatry and former Obama drug policy advisor. He adds that the health related provisions would hurt most in places that voted for Republican politicians. Those counties that swung for Trump in the election had higher rates of death of despair or deaths from alcohol, drugs, and suicide. While the House bill currently makes no changes to Obamacare, the Senate bill repeals the individual mandate, the part of Obamacare that requires individuals to buy healthcare insurance or face a tax penalty. According to a report from the Congressional Budget Office, such a repeal could cause 4 million Americans to immediately lose insurance and 13 million to lose insurance over the next 10 years. In addition, the CBO predicted a 10% spike in premiums. Of those 13 million who would lose insurance, nearly a third, or some 4 million Americans, likely have a mental or addictive disorder, says Richard Frank, a Harvard health economics professor who has been studying the effects of a potential Obamacare repeal over the past year. His prediction is based on the proportion of low income Americans who report a substance use disorder or mental illness in the National Survey on Drug Use and Health. Many of those who would lose insurance either because they choose not to buy it or because they're priced out due to rising premiums, as likely to be young or low income, two groups with particularly high substance abuse rates, notes Kenneth Humphreys. Just a few weeks of addiction treatment can be prohibitively expensive for many Americans. Not having insurance will make them vulnerable, added Humphreys. One thing that is consistent when you talk to addicted people is how they never thought this would happen to them. The Senate tax bill also calls for 16% cut in alcohol taxes over 2 years. That might sound great. What's wrong with cheap booze? But study after study has found that when alcohol taxes go up, deaths go up. Today, with alcohol taxes lower than they've been in decades, when adjusted for inflation, record numbers of Americans are dying from alcohol-induced causes. Brookings Institute's Adam Looney estimates that the tax cuts in the Senate bill would result in the additional 1,550 alcohol-related deaths each year, based on the economic impact of all the negative effects that alcohol can have. Looney goes on, the total local, state, and federal tax on alcohol should be roughly 4 times higher than it is now, and certainly not lower. So there you go. They're not keeping the addicts and the people that are struggling with alcohol in mind when it comes down to this tax plan that they are working on. Please tell me what you think, ladies and gentlemen. And I'm not surprised about the Obamacare. They've been after that for the longest. Please leave your comment and subscribe. And don't forget to hit on that notification bell. Peace, family.